Melanoma is a cancer that starts from the pigment-producing cells of the skin called melanocytes. And when caught early, those melanomas can be cured. But when caught later, they can spread to other parts of the body, including vital organs, so it can be deadly. Over 60,000 people a year are diagnosed with melanoma, and about 8,000 people a year die of the disease. Risk factors include sun exposure, as well as the skin type. So people with fairer skin types are more predisposed to getting melanoma. We know that UV rays are an important part, both UVA rays as well as UVB rays. So it's important for people to be careful in the sun, to practice sun safety practices, such as staying out of the sun during the most intense times of the day, which is usually between 10 o'clock and 3 o'clock. In addition, people need to cover up as much as possible with their clothing and a hat for their head, and use sunscreens with an SPF of at least 15. I think it's important for people to get frequent exams with their dermatologist, and if there's any lesion, pigmented lesion on their skin that they think is changing, that should be pointed out to their dermatologist. And so anything that's unusual, the dermatologist will biopsy that, and if it comes back as cancerous, then further steps will be taken from there. So it's very important to have a team approach in our melanoma and skin center. So as I said, we have dermatologists, medical oncologists, as well as surgeons who all work together. And every week we have a conference, for example, that also includes radiologists and pathologists, radiation therapists, all working together to try to come up with the best treatment plans for our patients. What we have are cutting-edge technologies for whatever stage of cancer that they have, cutting-edge technologies to take care of that, be it cutting-edge surgery technology or medical treatment. We're learning more and more about what the light switches are on a tumor that are turning the tumor on and off, and we're trying to gear that and personalize that to their tumor. That is our current goal, is to try to really personalize therapy to a patient's tumor. Melanomas are already trying to stimulate the body's immune system. In fact, in melanoma tumors, we can often find immune cells called T cells that are already trying to kill the tumor. Obviously not doing a good enough job because the tumor is growing. But we've learned to take those T cells out and grow them outside of the body to large numbers and then give them back. And that's called T cell therapy. And we're one of the only places in the country that offers that at the current time. I worked in Washington, D.C. at the National Cancer Institute for 14 years and was actually quite happy there, and went all over the country looking at different institutions. But when I came down to MD Anderson Cancer Center, I was really blown away immediately by the camaraderie here, by the teamwork that was here, and by the vision that they really wanted to do something as an institution against cancer. And so it was like no other place that I had seen in the country. And so I told my wife, got to move to Houston. And we've been very happy here.